Good evening and welcome to Metro Inclusive Health's live stream and podcast to Inclusivity and Beyond. I'm Cole Faust. I use he, him, his pronouns, and I am the LGBTQ plus division manager, and I'll be your host for tonight's conversation. Thank you for joining us for Rainbow Horizons, Envisioning the Future of the LGBTQ plus community. Tonight, we're going to have a live discussion with Metro Inclusive Health from Florida, the Montrose Center in Texas, Identity Alaska, California LGBTQ Health and Human Services Network, and Centerlink. And it's okay if you haven't heard about Metro or any of the organizations that I just mentioned, because they're going to give us a little bit more info about them. So I'll start off with Austin. Could you tell us a little bit more about your role and your organization?
Sure. So my name is Austin, pronouns are he, him, and I am the Communications and Marketing Manager for the Montrose Center. So essentially what I do is vaguely anything kind of tech related, social media, PR, website, kind of all of those jobs that are super fun thrown into one person, me. And then our organization, so the Montrose Center since 1978 has served LGBTQ Houston here, providing a wide array of programs and services. Our main program and service that we provide is behavioral health, so counseling and therapy and substance use recovery. But since then, we've also expanded to do a lot more. We serve clients living with HIV. We have support groups for various groups in the community, such as our transgender community, youth, seniors, and then we also do a number of kind of support services, so providing meals for seniors, helping clients with case management, helping them navigate life as they're coming out of incarceration or as they're recovering from instances of domestic violence. So we do a lot for the community here in Houston, and we're so glad to be able to do the work that we do every day.
That's amazing. Thank you so much for sharing. Let's move over to Laura. Can you tell us a little bit about your organization and your role?
Yeah. Hi, I'm Laura Carpenter. I'm the executive director at Identity. I use they, them, and she, her pronouns. Identity is based on Denina Land, also known as Anchorage, Alaska. And we serve throughout the territories and lands now known as Alaska, which is the homeland of many different Indigenous and Alaska Native populations. Identity's mission is to advance the lesbian, gay, bisexual, transgender community of Alaska through education, advocacy, and connectivity. And our vision is for a world where everyone is free to express and be proud of their gender identity, gender expression, and sexual orientation. And we fulfill that mission and vision in a couple of different ways. We have support groups, also for youth and elders and the gender expansive community. So some similar things to what Austin is doing, though I would say on a smaller scale. So we are two. So for my job, my title is executive director, but that when you're a staff of two also includes communications director, development director, janitorial, receptionist, grief counselor, support group counselor. So I'm both the person on the phone talking to a parent whose child doesn't know if they're a boy or girl or neither or both, and they're going through that journey. I answer the phone there. I also work with a variety of our groups, which are primarily volunteer led. So I'm really grateful for that. When I say it's two of us, I don't want to give the impression that Identity is only two people. Identity is many people, primarily volunteers. We also host Anchorage Pride, which is the largest pride in the state, and that is almost entirely run by volunteers, and I'm really grateful for that. So that's pretty exciting, and yeah, we do a lot, but I'm excited to do more as well, and glad to be here. Thank you.
Thank you for being here. Yes, I think it's very common in the line of work that we're in that we wear many hats. And I think that we're better at what we do because we are open to wearing those many hats. Because when we can listen to an individual and hear their personal story and then take that back into the policies and procedures and programs that we develop, it makes them that much stronger. There's less of a disconnect that we see in some other structures. So thank you, Laura, for being here. We'll move along to Amanda. I invite you to talk about your organization and your role.
Yeah, thanks, Cole. My name's Amanda McAllister-Wallner. I use she, her, hers pronouns, and I'm the director of the California LGBTQ Health and Human Services Network. We are an advocacy and technical assistance organization based in California, and we do statewide advocacy work to promote LGBTQ health equity and LGBTQ people living healthy lives, thriving. We also have 2 statewide projects, Out for Mental Health, which specifically promotes mental health equity throughout the state, both at the local level, working with a number of local LGBTQ serving organizations to promote county policy change and systems change in their communities, and doing leadership development and skill building at the local level. And then we also do statewide advocacy, working to promote funding and investments and policy changes that will make culturally affirming mental health care more accessible for LGBTQ Californians. We also work statewide on tobacco control policies, again, with a real focus on empowering LGBTQ Californians to take their health into their own hands, to have the tools and the information to live healthy lives, reduce tobacco-related health disparities. And we also work on an Adverse Childhood Experiences ACEs Aware project statewide as well, promoting the use of trauma-informed care and training on how to do ACEs screenings for providers throughout the state.
Amazing work. You know what stood out to me when you were speaking is the word thriving. I think it speaks to the progress that we've made as organizations and as LGBTQ community activists, advocates, that we can use that word and really focus on thriving of our community, because so many years ago, you know, when we think back to Stonewall riots and police raids in bars, it wasn't really about thriving at that time. It was just about basic rights and being treated as human beings, not being in situations where we were made out to be less than human, to put it simply. So I love that thriving is a part of tonight's conversation, and I think that theme is going to come through later as we talk about what we're envisioning for the future. Denise, I'd love to invite you to talk a little bit about your role with Centerlink.
Hey, Cole, thank you. And thanks for the invitation. So my name is Denise Spivak. I'm CEO of Centerlink, which is the Association of LGBTQ Community Centers. We were founded in 1994, and we are based in Fort Lauderdale, Florida. We serve over 275 LGBTQ community centers and community serving organizations throughout the US, Canada, China, Australia, Colombia, Uganda, and the UK. And we're, for lack of a better parallel, we're kind of like a chamber of commerce. We provide training, technical assistance, resources, and a network for all of these amazing organizations, including Montrose Center and Identity, who are both members. And we provide a network for them to have peer support and connection and be able to not feel alone in this work. I too love Amanda's word of thriving, right? And it used to be where we were exactly as you were saying, Cole, we were just trying to survive. Now we can talk about thriving, which is great. And the centers that are on the ground doing the work locally every single day, providing so many important resources, often life-saving resources and services, they can often feel like they're all alone. And so what Centerlink is there to do is make sure that they know that they're not, and to provide support in any way that we can.
Thank you so much. Last but not least, I want to give a little bit of overview about Metro Inclusive Health. And we've definitely benefited a lot from being a part of Centerlink. I know everyone is equally passionate about this work and reaching our community. And it's such a big help whenever we can save energy to connect with other people and learn about what worked well for them and implement that back in our own communities rather than continuing trial and error. So Centerlink has been an important resource for us. But so again, I'm the LGBTQ plus division manager. In my role, I oversee our social and peer support programming for the LGBTQ community. For anyone who's not familiar with Metro Inclusive Health, we are based in the Tampa Bay area in Florida. We do LGBTQ inclusive primary healthcare services, counseling services. I have to brag on our trans healthcare model because we have counselors that can write letters of support for members of the trans community. In the same building, a trans person can get their lab work done. They can get their hormone replacement therapy prescription there with the provider that's affirming. They can also, through our partnership with MailMeds, get their actual prescription all in the same place. And, you know, I'm a trans person myself. When I started my transition, I had to go to 4 or 5 different places, all with differing levels of copays and differing levels of respect and understanding for me as a trans person. So Metro has really done an awesome job making access to care for the trans community improved. We also do LGBTQ plus community programming and HIV education, outreach, testing, and sexual health education. So much like everyone else on the call today, we try to really have a comprehensive model when it comes to caring for individuals that come into our center. So the next thing that I want to ask about, we're in LGBTQ History Month. I'd love to hear a little bit about the history of your organizations. Does anyone want to start us off?
Yeah, I definitely can. So as I mentioned before, the Montrose Center was founded in 1978. Back then, we were called the Montrose Counseling Center. And actually, it's a really interesting story how we kind of came about. So back in the late 70s, I want to say it was 77, that was when the LGBTQ community in Houston was really kind of coming together and finding its footing as a community, really, and as an activist community. And so they kind of found their footing with Anita Bryant when she came to town to have her dinner, at the Texas Bar Association. And there was a really big protest, and that kind of really sparked the activist community here in Houston. And so once that event happened, and, you know, there was that whole nationwide campaign, the Save the Children campaign, after the non-discrimination ordinance was passed in Miami-Dade County and then repealed because of the campaign, the activist community here got really involved, and they wanted to have a town hall meeting, kind of figuring out the direction of LGBTQ Houston and, you know, what services they wanted to see, what things were needed from lawmakers, you know, who was going to advocate for these things on behalf of the community. And so in this town hall meeting, they had this really big gathering. It was about 4,000 people here at the Astrodome, which is our old baseball stadium. And they had a whole day of programming. They had some elected officials come and speak. And there were 4 main organizations that came out of that town hall meeting. One of them was the Gay and Lesbian Switchboard, which was essentially kind of a crisis helpline that is now actually a program of ours here at the center. There was the Montrose Clinic, which is now Legacy Community Health, which is a community-based health center here in Houston. Sounds like it's pretty similar to Metro Inclusive. They have, you know, a lot of locations across the county. They do a lot of sliding scale or free payment for clients if, you know, financial aid is something that they need. There was also a Hispanic organization that came out of it. And then there was us. So we were one of the community organizations that came out of the town hall meeting from the need of, you know, culturally competent and LGBTQ affirming behavioral health. And so we started as a really small shop of part-time kind of counselors. And eventually we grew to be the 100+ person organization that we are today. So really, we have to kind of thank Anita Bryant for kind of sparking that campaign across the country, rather, and for really kind of igniting LGBTQ Houston, because there were so many activists that were so just fired up in response just to her presence here in Houston. And that really was kind of the impetus for a lot of change here. We kind of call it our Stonewall in Houston as well.
Thank you so much for sharing. I think that's also not something that's uncommon in communities across the country, that there's some kind of catalyst that sparks a revolution, if you will, right? So thank you so much for sharing the history of your organization. Laura, would you like to tell us a little bit about yours?
Well, it makes me want to do a research project to see why identity I started exactly. I'm so curious now. What is the catalyst? I know like the story on our website, but I don't know that exact catalyst. So you've just inspired me to go back and do the research. It's probably not Anita Bryant coming to Alaska. Maybe it's the pipeline. I'm not sure. So Identity was founded in 1977. And primarily as a gay and lesbian community center. And that's how it was known for a long time, was the Gay and Lesbian Community Center of Anchorage. And we still get calls for that. And we still get called that as well. And for a long time, it was also that completely volunteer run. I think even though the organization's over 40 years old, I think I'm only the 4th executive director. So it stayed kind of small, staying very community driven for a long time, and it has moved around. And so I was just looking in my office the other day of a picture of it in the 80s when it was on another part of town in this small, it just looked like a house, but they saved a rock that they painted pink because someone threw it through the window as a protest of having a gay and lesbian center. But instead the community came together and painted this rock. And it's like, no, we're the center, we're stronger, we're thriving, right? Going from surviving to thriving. And so I like those moments of history. I also like that it has stayed around. And I also realized that an organization that's formed in the 70s by primarily cisgender white people has some challenges. So there's a lot of wonderful things about being an organization that is 40 years old, and there's a lot of challenges, and so we're working through it. Yeah, that history is present, right? Sometimes as we're going through things, we're like, why does this policy exist? Mm-hmm. And you're like, oh, because it's something that happened 2 decades ago that really isn't relevant, or maybe it's a white supremacist mindset that we need to just get rid of.
Absolutely. And I know Centerlink actually just curated an anti-racism workshop that's been going on. So that's definitely something that's at the forefront of my mind too. And maybe you can speak to that a little bit, Denise, when we get to you.
Yeah, and I didn't attend it, but our other coworker did and said that I need to hire Lucy and our board like immediately. So,
yeah, absolutely.
So Denise, if I don't have her contact information, I might come for you, and it's happening.
So thank you so much for sharing. Amanda, would you like to share a little bit about the history of your organization?
Yeah, absolutely. And I can definitely relate, Laura, to kind of what you were saying, right? I have this oral history of how the California LGBTQ Health and Human Services Network came to be, but, we've got to do a better job of writing some of this stuff down and making sure that we preserve it, especially since, we're celebrating LGBT History Month right now. So the network is relatively new, I think, among this crowd. Was founded in 2008 by a couple of pretty visionary leaders in California, Lance Toma, who founded the Centerlink member, and founded the San Francisco Community Health Center, formerly API Wellness. Mason Davis, formerly the Transgender Law Center, Judy Appel, who's with our Family Coalition. So really a number of folks came together in the late 2000s, 2008, and realized that a lot of LGBTQ advocates didn't really have a seat at the table in health reform decision making. We'd historically been in this reactionary place of just scrounging for scraps and making sure that our communities were receiving HIV treatment, or were, just getting some of the bare minimum in a lot of cases when it came to healthcare. And they saw an opportunity to do more and to be really proactive around LGBTQ health in the state. Back in 2008, even, before Obama was elected, before the Affordable Care Act, Arnold Schwarzenegger was actually working on health reform in California. And so they wanted to make sure that LGBTQ people had a seat at that table and were a part of those reforms that were happening. Health reform didn't go too far in 2008 under the Schwarzenegger administration. But of course, just a few years later, we did get the Affordable Care Act. And we did have a seat at those tables. And thanks to the work of those early leaders at the network, we were able to really make, I think, a lot of really important gains for LGBTQ health as the Affordable Care Act was being implemented in California. We ensured that transition-related care was covered by private and public health insurance. We ensured an expansive family definition in the time before same-sex marriage was legal. We ensured that that Covered California, our ACA exchange, actually contracted with about half a dozen LGBTQ organizations throughout the state to do proactive outreach and enrollment among our communities. I've heard, because I wasn't there at the time, but some conversations had to be had with the state about why, folks were doing outreach outside of gay bars at, midnight, and why that was totally inappropriate use of state funds, for healthcare enrollment. And so, I think that's been a big part of our ethos ever since, is making sure that we have a voice at those tables, that we're informed by community voices and community leaders, by the folks on the ground who really are in touch with what our communities need, and bringing those voices to the state. And we're continuing to push the envelope, I think, in California, and make sure that we can continue to expand what it means to really stand up for LGBTQ health, and to, as we've said a couple of times, to really thrive and to really, take control of our health and well-being.
Thank you so much for the important work that your organization has done and continues to do. Definitely a lot of empowering of individuals and communities. Denise, tell us a little bit about the history of Centerlink.
I will. And we are just one big happy family. Lance Thoma's on our board. Lorraine Langlois, who is the CEO of Metro, is on our board. So really, there's always connections somewhere along the way. But speaking of CEOs, so two sort of powerhouse CEOs, Lori Jean and Richard Burns, are two of our five founders. We had the leaders of the five largest LGBT community centers at the time, back in the 90s, early 90s. And one of the reasons I know this history is because we just had our summit, and I had them come on and tell us our history so that I would know it for the future. So you might want to do something like that in a session if you can. But they sort of, they were all friends, and they talked a lot, and they supported each other. And it became really apparent to them as they were hearing from other centers along the way, at what would turn out to be Creating Change, and at different LGBT health meetings, they would have a convening of LGBT community centers. And it became really, really apparent that centers needed support. And so from that, the National Association of Lesbian, Gay, Bisexual, and Transgender Community Centers was born. One of our former CEOs, Terry Stone, decided that was way too long of a thing to say when he answered the phone, so he changed it to Centerlink. But that's really where it came from. It was this need for center leaders to have support. The average tenure back when Centerlink was started, the average tenure of an ED of a center was abysmal. I mean, it was really minimal, because they just burned out. There was no support. There was nobody to help them along the way. And everybody felt like they were having to recreate the wheel, and there was really no need for that. So so that's really why we were founded. It was to create that connection and to give everybody the knowledge that they were not alone, to hopefully improve the tenure of EDs and thus improve the success rate of LGBT community centers. Back then, they were probably, I don't know, 50, 60 in number, and now we're over 270 and more. There's some coming in every month that we've never heard of. So it's really about connectivity, about support and thriving. Let's keep it going. I think we should have to say thrive in what we're saying every session.
Absolutely. I love it. I'm here for it. Yeah, you know, the other thing that's interesting is with the name change, I think organizations also have to pivot with the times and change. And so I want to talk a little bit about what you all might have had to change and shift with during 2020, because it's been an interesting year for everyone. But before we do that, I also want to talk a little bit about the history of Metro. So I'll keep it brief because I'm the same. I read what's on our organization website, but I also have had the opportunity to meet the people that were then at the inception of Metro, which I feel really honored to have the chance to do that. But Metro was conceptualized in 1992. It was actually a couple caring individuals in metropolitan community churches in St. Petersburg, Florida. And this panel is aware, but maybe not all the folks are aware. During the 80s and early 90s, it was really difficult for folks living with HIV to access competent care, affirming care, accepting care. There was a lot of discrimination, lack of awareness, both in the med community and beyond. And so Metro Inclusive Health was born. Our name was Metro Inclusive Health back then. Our marketing person put me in jail if I say the previous name, so I'll keep it at Metro Inclusive Health. But we were founded with a mission of inclusivity, and we just grew exponentially since then. So back then it was more the HIV medical management. And again, I talked a little bit about the overview of what we are now, just really offering wraparound comprehensive services to folks in the community. So 2020, I know there are folks out there who kind of cringe a little bit when they hear 20, but I think it's important that not only we talk about the challenges that have come up during 2020, the silver will. Anyone can jump in. Some things that your organization has accomplished this year or milestones that you've learned in these challenging times.
Well, I'll jump in 2020 because my organization hired me.
Yay!
Monumental.
I mean, that's not like the most biggest thing, but it is. So I've been here three months. So also that caveat when I talk about the history and the programs comes with that. But for me, they haven't had an executive director for a couple of years. So yes, it is hiring me, and I'm very grateful to have a job and to get a job during a pandemic. And also for me, it's exciting because it shows the board and the community is excited about the future of identity and its programs, and they're ready to invest in a leader and in staff to make that mission better, to serve the community better and more possible. And we actually hired two. So both of our full-time staff were both hired this summer. So it is pretty exciting. But we also are, among everyone else, figuring out this virtual world. I would say one of the things that I would point in that positive for us is that we hadn't hosted a lot of what I would call community conversations. We had our support groups and a very specific targeted audiences, but we hadn't had like community-wide conversations. Let's get together and talk about health, for instance. So we've now had a couple roundtables on health, And people really want that. And that is something we can continue to do even after we can get together in person again, is these community-wide conversations, some virtual, some not. And the fact that virtual is better for us to serve some people who live outside of Anchorage. We're not only the only queer community center in Anchorage, we're one of the only, if not the only, in the state. And so we get calls from people in the villages and the rural areas and a variety outside of Alaska. And I hope that with this, there's some virtual programming they can attend too. So that's pretty exciting.
Absolutely. It's interesting how much growth has also happened, because similarly with Metro Inclusive Health, we weren't offering our social programming on a virtual platform prior to COVID happening. And when March hit, we very quickly figured it out, did the research. Everyone had a Zoom account, right? This happened very quickly. And we were also excited to see that it expanded our reach, that folks that were living in more rural or conservative counties around us that couldn't make the trip to our physical locations could then click, pretty much everyone has a smartphone these days, could just click a link and then show up in a space where they knew that their name and their pronouns would be respected, and that they could talk through some of the isolation and challenges that they're experiencing without having access to a center. So that's definitely been one of the silver linings, I think, across the nation for a lot of folks that are curating LGBTQ spaces. Thank you for sharing. Anyone else want to dive in? What 2020 has brought you in terms of challenges, and maybe what you've learned from those challenges, what you'll incorporate in the future from those challenges?
Yeah, I mean, I think just like what Laura said, we learned how to thrive in the digital world and learn how to thrive in, reaching people that we didn't even know that we could reach before. Obviously, we had to pivot our services pretty quickly to be online for our clients, so we could still get them that counseling and therapy that they needed or whatever other services we're providing. And I think, if anything, it really taught us how nimble and how flexible we are, because we essentially had to completely turn over everything, in just a matter of a few weeks. That was our diner that we used to have, again, teletherapy appointments, case management, support groups for our youth, for our trans community, like everything we had to just kind of turn on its head and figure it out like very quickly. So I think, if anything, like I said, it taught us that we can do anything that we set our mind to, and we're super flexible when we need to be. But the other thing is, kind of continuing on that same note, I mean, we were able to raise over 1.5 million for COVID relief for the community. It's been pretty great. We're still trying to give away some of that money, specifically to our clients living with HIV and some of our trans members as well, our veterans as well. We're still trying to get that money out there, but I mean, the community came together really quickly. We were fortunate enough that our county provided a lot of funding to us and other organizations throughout the area to be able to provide direct financial relief to our clients, or to be able to pay bills for them in their name. And so, within a couple of months, I want to say by the end of July or beginning of August, we hit that $1.5 million mark. So again, just showing that, we're determined to continue operating for the community and taking care of them, and that we can really do it no matter what the environment is.
Another theme, I would say, resiliency, is something we've seen, when we think about LGBTQ History Month, a lot of the activists, advocates throughout history have had to be resilient and get creative and really focus on their determination for what they're hoping for on the other side. And it sounds like that rings true for your organization as well, and all of our organizations during these times. Anyone else want to jump in about what 2020 has brought them?
Yeah, I'm happy to. And Montrose Center has done a phenomenal job around COVID, but also did a phenomenal job around the hurricane a few years ago, also providing a lot of community support. And a lot of our centers have this year. So, when this hit, the first thing was, oh no, what are our centers going to do? And as they were pivoting on a dime, we thought, okay, now what are we going to do? Because so much of what we do is going out to centers and helping centers who kind of have that time to say, oh, we want to do strategic planning. Oh, we want to do this. So we really focused more on providing resources and space to share ideas and just sort of a way for people to connect and talk about how they were responding. We did a financial impact survey to see how COVID was going to affect the centers financially so that we could put that out to funders. And interesting side note on that, at the time we did that, and that was back around April, May, the centers said that if they had not received any more money, meaning galas or prides, that they were going to have to cancel. We had about 90% that said within 12 months they realistically could look at a significant change in their existence and their programming, and or just closing altogether. And the centers have been incredibly resilient in how they've fundraised. And some centers are actually having a better year than they had anticipated before COVID. And some centers are still struggling, but overall it's been it's not been as dire as we thought. We don't know of any centers that have actually yet had to close as a result of COVID. One of the monumental things for us, though, was getting to partner with organizations like Procter & Gamble and GLAAD, and the casts of like Queer as Folk and Orphan Black to do fundraisers that would benefit centers. And so through our granting and the fundraising this year, we've been able to pass through over $1 million to centers. And so that's something that we're really proud of, and that we hope we can continue to work with outside organizations. It's really been a year of, yes, people knowing who Centerlink is, but getting to really spotlight centers in the fundraisers and the online events that are happening, and the amazing work they do. So it's, you know, if you can make lemons out of lemonade, or lemonade out of lemons, depending on which day it is, then that's actually something that I think, you know, it's really been brought to the forefront, the amazing way that centers have pivoted and turned on a dime and just continued without a blip, without even a hiccup, serving their community. So.
Absolutely. I think we at Metro Inclusive Health were really grateful for Centerlink and the connectivity piece, particularly with our youth programming, because with YouthLink does a really great job helping all of the youth program staff stay connected. And our youth programming staff, we typically have an annual LGBTQ summer camp, which everyone gets really excited about. Our staff was also really excited. And then as soon as it wasn't safe to hold a summer camp this past summer, we kind of deflated. And so we got together, we started reaching out to other youth serving organizations via Centerlink to see what they were doing. And we ended up doing a virtual summer camp, which doesn't sound like it would have all the same charm, right? But it ended up being pretty close to the same feelings that we were able to elicit with LGBTQ youth. And we were able to reach folks all over. We had youth that were from Texas, Alabama, Ohio, Indiana. We even had somebody find us from Canada. So it was really incredible. We shipped out, we mailed them little care packages where they had all of their activity supplies with them, logging with new friends, and we sent them even the supplies for s'mores so that they could have s'mores at home during the virtual campfires. So that type of creativity, I think, is being demanded of all of us, but it's really incredible to see that during these times, our staff continues to reach out to other organizations and create amazing. I'm getting feedback that I'm breaking up a little bit. Sorry about that. But it's amazing to see the creativity, and it's thanks to Centerlink and other organizations for being willing to come together to make that possible. Another thing that I hope that folks will take away from this conversation is, much like we're all doing right now, coming together to talk about what works, what hasn't worked, the challenges we face, that folks in their communities kind of on a grassroots level will do the same, because that's really how we're going to get to the future that we're envisioning and dreaming about, right? So we'll talk a little bit more about dreaming and looking ahead, but I want to give Amanda a chance to talk about what 2020 has brought.
2020 has been tough. I mean, I think, similar to what folks have shared, I have been really inspired and impressed by what a lot of our partners and members, how they've been able to adapt. We served, I think, early on as both a connector, connecting folks with each other so that they could, talk about what are some of those strategies that are working, what are some of the shared challenges that we're facing. We heard a lot about LGBTQ youth dropping off the map, and program folks not being able to reach them, and not knowing what was going on, or not knowing how to convert certain programming to online. And I think that being able to have other folks to talk to about that is really important. And I think it is important to notice, though, that we can't, there have been some real challenges for our communities, going through this. We also held a series of virtual town halls throughout the summer. Heard a lot about just the toll that the uncertainty, of the pandemic and the economic situation is having on people's mental health. Potential lack of privacy or lack of supportive, housemates or living situations. Those things are really taking a toll. And I think it's important to recognize that really the need is greater than ever. And it's, I think it underscores even more how important it's been for our LGBTQ serving organizations to be so adaptive and creative in making sure that our communities get services, because there's a huge need right now. And definitely more of a need than we're able to meet. And so, keep donating and keep, doing all those things, because it's really, it's really, really important right now, and people are needing it. The one other thing that I'll just highlight out of 2020, though, where we have had some success as well, is on the policy side. We worked really closely with Governor Newsom and State Senator Scott Wiener here in California to ensure that California is collecting and reporting on sexual orientation and gender identity data in terms of COVID-19 impacts. So we passed a bill here in California, and the Department of Public Health created new regulations, new policy requiring that sexual orientation and gender identity be included in the demographic information that's being collected during COVID-19 testing. So we're still waiting to see some of the results of that data collection, and still waiting to see big enough numbers to be included in our state's data reports. But, it's something that has been a challenge to get resources into our communities, to do planning to address the unique needs of our communities when we don't have that data. And so we're really happy with the efforts that the state has made to do that. We worked with Equality California on that legislation. It's a really important step, and we need to, keep pushing to get better information about how COVID-19 is impacting our communities and just about our health and well-being in general.
Absolutely. Something that stood out to me when you were speaking is the uncertainty of everything right now. And I think for the LGBTQ plus community specifically, there's already this kind of undertone of uncertainty, right? We know that a lot of LGBTQ folks are constantly experiencing minority stress, for example, of when's the next hate crime going to happen, or when am I going to be discriminated when seeking housing, and things of this nature. So when you add a pandemic on top of that, it kind of just elevates everyone and takes their stress levels to sometimes a really difficult place to manage. So I think the work that everyone is doing right now to reach out, and the support that we're receiving and giving to each other is critical. So looking ahead, we're doing really incredible work this year. We've all been really creative in how we continue to deliver services. Where do we go from here? What's the next year look like? What's the next 3 years look like for your communities and your organizations? I know that's a big question. So yeah, whoever feels ready to tackle that. I know most of us are just
Go Austin. Go Austin.
Well, I can look at least the next year. The Montrose Center started a fundraising campaign a couple years back in order to create the first LGBTQ affirming senior affordable housing complex here in the South. And we have been building through the pandemic, and we are still scheduled for a March 2021 opening. So at least the next year for us is really going to be opening that senior center and really giving all of our seniors a home. Because at least within the Houston metro area, we have this, what we call the Loop 610, which is kind of like the main part of Houston. And living inside the Loop, you have access to a lot of things in the city, including our center. You're close to, different neighborhoods, but it's also very expensive to live within the Loop. And so a lot of seniors, especially as they age into retirement and have to live in communities, they're living on fixed incomes. They may not have the financial resources available to be able to afford a place inside the Loop, close to the Montrose Center, close to their other LGBTQ seniors, close to resources that they need. So the senior housing that we're building is called the Harrington Senior Living Center. It's going to house over 300 seniors, both LGBTQ and also seniors from our Third Ward neighborhood. Third Ward is a historically Black neighborhood here in Houston where we're seeing a lot of gentrification. And so a lot of residents are being pushed out. And so we're really trying to work with the city and with other stakeholders to make sure that they also have a place at the center. But there will be a lot of amenities. The primary one, which is going to be a legacy community health clinic. So you can literally just walk downstairs and go for your, wellness checkup appointments, get your prescriptions, all that kind of thing. And it's also going to be, a hub for the community, right? So even if we have seniors that don't live at the Harrington Center and they happen to live elsewhere in the city, they can come to the center and still enjoy events once it's safe to have them again. But, we really want to see it as a hub for all LGBTQ seniors in Houston, not just the ones that are living there, because it's becoming increasingly difficult. And we're finding that a lot of our seniors are living in social isolation and just don't have the same kind of social support groups that our youth do, or anybody else throughout the city. So at least for the next year, that's going to be kind of our project, transitioning that center to be open, filling it with residents, really kind of getting it up and running, through COVID. But for the next 5 or 10 years, that's a really big question. I think what we would like to see here in Texas is some non-discrimination ordinances, whether that's local or statewide, because we did have one called HERO a few years back in 2016 that was passed and then repealed. And so just knowing how volatile our rights are right now in this political moment, it would be really great for us to be able to work with advocacy groups and, lawmakers here in Texas to try and get something on the books. That way we can have those protections if we can't guarantee them at the federal level.
Those are great goals to have, I would say. I really think that with our LGBTQ elders, sometimes our LGBTQ elders are known as Generation Silent, right? Because as aging process happens and there's fear about who will be there to advocate for them, what communities will be accepting of LGBTQ elders, they're sometimes having to go back into the closet. So creating a space where there's not only a place to live, but a source of community where folks are not experiencing the isolation that can happen for LGBTQ elders is crucial and really important work. So I'm very excited to see that become a reality. Who else is ready to tackle the future?
I'm the future. Come at me, 2021. I mean, I really I want the future to happen now sometimes. I want New Year's Eve to be tonight so I can be over with 2020. But I'm very inspired by everyone. And one of the things I was thinking about is that's a really good goal to have COVID testing tracks sexual orientation and gender identity, because people are asking us, they're like, how is COVID affecting your community? And I'm like, you're not tracing it. How would you know? How would I know if you don't know? And I think that is one of the challenges of identity being, in a way, the most well-known, but also volunteer-led queer organization in Alaska. We aren't the only queer organization, but if you Google gay Alaska, we're usually the top one to come up. And so we're expected to do all these different things, and we can only do so much. So I want you to come in and help us with the senior center. I want you to come in and work with our senators who just voted for Barrett, and I want all those things. But for identity, back to what is in our control, is we are actually looking to expand services, in particular into healthcare, because that is a huge need in Alaska, especially gender affirming healthcare that people can do in town. Like, you're talking about going outside the Houston area. Most people have to leave the state of Alaska and go to the lower 48 for a lot of services. There are some services. And so what we've been doing is we've been partnering with a clinic here in town that is, I would say, asked to do everything LGBTQ health-wise, right? And it's too much. It's too much to ask on one clinic. And so some of these roundtables and conversations we've been having is, what is identity's role? Where can we serve best? What does the community need most? And this has been happening throughout. I think COVID has both amplified the need and made it harder to do the assessments, but we are working on that. And I would say in the next 3 years, we will probably be offering services that, in particular, counseling, therapy, we've seen gender affirming care, are just behavioral, and some clinical needs but they're so high. And a lot of training. That's another thing that we've seen come up again and again, is just a lot of providers not knowing how to serve LGBTQ people. One of the things that came up in a roundtable we had was someone was talking about, he went to the doctor, and they were like, well, are you going to get surgery? Do you want to get your gender surgery? And he's like, I'm just here for an inhaler. Okay, I have asthma. I don't, you know what I mean? He wasn't there for gender specific care. So he had other needs. And so this is what we're dealing with here in Anchorage. And, but I am excited. I know it sounds a little daunting, very daunting, but that's why I do really appreciate these conversations and Centerlink, because I know it's possible. I know it's happened in places even more conservative, even more economically depressed than Anchorage. So I know that we can do it too. And I know I don't have to reinvent the wheel, right? It's not me doing it. It's us with all our partners. It's working with our AIDS association. It's working with Planned Parenthood. It's working with other clinics in town. So I am both excited and daunted and a little jealous.
Yeah, I mean, I think we actually in California even have some of the same issues though too. The amazing access to insurance coverage for transition-related care has really exposed the deficit of providers that can actually meet those needs and provide that care. We see wait lists of years sometimes for certain transition related services. And so there's a lot of work to do still here in California to really deliver on the promise of universal access to LGBTQ affirming care, especially transition related care. And that means, training providers in all parts of the state, so that we're not having people that, have to travel 3-4 hours. We surveyed folks last year and found that, there were people who had to travel so far that it required an overnight stay just to find an affirming primary care provider, not even a surgeon, not even a specialist. But a primary care provider in California, which I think, we really pride ourselves on being a leader in LGBTQ health. And we have a lot of work to do. And I think that, our vision really is a state where every single LGBTQ person has access to quality, affordable, and affirming healthcare, and I think we can get there, but there is definitely a lot of work to do. And it means making sure that our local communities, our providers, our hospitals are really living up to the promises that we make at a state level, in Sacramento, and are really living up to their own visions of themselves as LGBTQ affirming providers. I think a lot of folks think that they are, but they and want to be. But we still have some work to do to make sure that they're really serving our communities, and particularly the most marginalized in our communities, who are still experiencing, microaggressions, transphobia, racism, when they walk through the doors to seek services. So, just a small goal for the next few years for us.
Yeah, just a couple of things. Yeah, and as I look at community centers, so we got a busy month or two ahead in terms of stuff that will impact all of us, I think. And aside from what's happening very, very soon, we also have the holidays, which is going to be this is going to be like the first COVID holidays, and I think that's going to be really a lot of it's going to be hard for people, and I think our centers are going to have a lot coming again as in terms of support. That said, we're going to be working through our programs, HealthLink, YouthLink, ActionLink, and all of our partners to help support our member centers. We're going to be working concurrently and collaboratively with our centers around anti-racism work and equity work. That is really a big thing for a lot of our centers right now that they're focusing on. And also, helping to connect our centers, as Laura was saying, you're not alone, but part of our role is to help you figure out who you're not alone with. And definitely healthcare and senior and youth housing is one of the are three of the biggest focuses of our centers as the bigger ones grow, and helping the smaller ones to grow to where they can even start thinking about that. So that's where we're going to be.
And similarly to everyone else, there's not a small checklist of things that we'd like to see in the future, but Metro Inclusive Health is, with COVID-19, we've really been able to expand and mobilize a lot of our telehealth offerings, and that's helped so many folks for a variety of reasons, whether it's transportation issues or fears or stigma, related to coming to an LGBTQ center or to getting an HIV test. There are so many ways that we've been able to make care more accessible. So I think we want to continue to see an expansion there on the same lines with our LGBTQ plus community programming, making sure that we're able to reach those LGBTQ youth and those LGBTQ seniors that don't have a space, that they're not plugged in. And also, you're not alone, Laura, in that there is still a lack of LGBTQ providers, even in the affirming providers and LGBTQ providers for that matter. In St. Pete, in the city of St. Pete, which is a very LGBTQ plus friendly city, one of the largest pride parades in the nation, right? So we also continue to do training with other healthcare agencies to make sure that we don't continue to hear stories from our clients about being called it, when they go into an emergency room, because that provider isn't being respectful and obviously hasn't done the professional development that they should do to make sure that they're respecting LGBTQ folks. And I think, it's just really unfortunate that LGBTQ people have to worry about these types of things in times when they're most vulnerable, times where we're accessing healthcare is where we at least need someone to treat us with basic human decency. So yes, that battle is still very much real and something that we're also working on. So it's good to hear that folks around the nation are kind of united on that front. The last thing is, how do we make all of this happen? What can folks that might be in the audience tonight do to support the good work that you all are doing?
I can go ahead and start. Visit our website, montrosecenter.org, and you can find a ton of information on there. We have a COVID-specific page with some of the stuff that we're doing. We are doing a lot of drives, virtual drives. So we have an Amazon wish list where people can donate to our emergency food pantry. They can donate PPE for seniors. We also have some virtual opportunities on our volunteer portal where people can write comfort cards for our upcoming transgender Thanksgiving drive-through, where we're going to be providing meals to the transgender community for Thanksgiving. So go on our website, kind of look at what's there, just pick something that you want. And if you want to donate, please go ahead and donate.
So I would say find your local LGBT center. You can do that at lgbtcenters.org. If you work for a company that has ERGs, connect them with your center so that they can provide support or donate or however that works. And you yourself, if you can donate or volunteer your time, volunteer your talent, centers are always needing people to help them do the work that they do. So just get involved. No one of us can do this alone, and so don't stay out. Get involved.
All that, and don't be afraid to fail in your journey and in your participation and in your work with this. I hear a lot of people say, well, I want to help, or I want to do this, but I don't, what if I mess up, or what if I say the wrong pronouns? And it's like, you got to start somewhere. Be aware that you're going to mess up, forgive yourself, have compassion for your flawed human self, which we all are, and then move on and do the work.
Yeah, that's super important. I would say also vote. We are trying to change policies, and it's a lot easier if the people making those policies support LGBTQ communities. So, you've got a couple of days left to make your voice heard. So get out there and make our jobs easier, make your lives easier. And you can find us at californialgbtqhealth.org or on social media, CA LGBTQ Health.
Awesome. Thanks so much, everyone, for your input and your wisdom. There's not too much more I can add to that. I think voting, getting involved with your local LGBT center, whether it's with your time or money or ideas, those are all really important ways to help us continue all of the mission, the united and the individual missions that our organizations have. And I think the last thing that I would say is don't discount what you can contribute. We talked about some very tangible ways that you can get involved, but even passing along an idea or volunteering to be a guest speaker in a youth program, there's so many different ways that folks can get involved. So there's no doubt in my mind that anyone who's tuned in tonight can contribute in a meaningful way. So, and I think that's really what it's all about, is us all taking accountability and recognizing the worth that we bring into our communities, whether we're LGBTQ plus or an ally to the LGBTQ plus community. We're important on this united front, and that's how we're going to continue the theme of thriving, right? Getting everyone to a place of thriving. So thank you so much. It's such a pleasure to have everyone here together. Like I said earlier on, I hope that conversations like this one will pop up all over the nation, all over the world even. And please tune in next time for our To Inclusivity and Beyond podcast.
Thank you.
Thank you.
Everybody.
Thanks, Cole. Thanks, everybody.